Hi, welcome back to RohrichKnosepodcast, helping you become a better and more educated you. Well, today let's talk about Taylor Swift and her plastic surgery journey. Now, as you all know, she's an amazing rock star, singer, songwriter, entrepreneur. She's amazing. And from the beginning to now, she has been a world sensation and just has rocked the world. And her Eras tour has been just astonishing, you know, from the USA to Australia to Asia to Europe. It's just mind-boggling. But as you know, when Taylor Swift, because she's a real amazing public figure, people always talk about her plastic surgery. And did she or didn't she? And I think whether it's from, they talk about her nose, her eyes, to her lips and cheeks, to breast augmentation, let's just pursue that journey. I've discussed this before on the plastic surgery journey of Taylor Swift, but it keeps coming up again and again and again, and I think it's time for an update. So, has she had a nose job? Has she had a rhinoplasty? And I think some have speculated that, and I think going from 2008 to 2023, yes, I think certainly that, and of course I'm not a surgeon, I'm a board certified plastic surgeon and I'm a rhinoplasty expert. I think that, you know, she may have had a rhinoplasty, her dorsum is a little narrower, her tip is more refined, and I think it's a nose that matches her beautiful face. So I think it's a good thing. And you know, these are all things that are very powerful because a well-done rhinoplasty, which I think she had done, is excellent because it then allows you to look at her eyes and her face and her cheeks and her lips. And of course, all of those things have also had, I think, some alterations and I think some improvements. But I think that's the beauty of having you know, that look. So, you know, she's beautiful to begin with, but I mean, her rhinoplasty, I think, is really part of that. Because when you look at someone, you look at their eyes, their nose, and their lips. And she certainly has had some mild to modest alterations in each of these areas, and that's a good thing. So from the before Taylor Swift to the after, you can see the shape of the dorsum and the tip has been refined. And the eyelids have been reshaped, and the hooding of her eyes have also improved. And so she's had potentially eyelid surgery, and she's had her cheeks enhanced and her lips enhanced. And all these things really make for a very powerful look. Because remember, you look at their eyes, their nose, their lips. So, you know, has she had a brow lift or upper lip blepharoplasty? Possibly. And certainly, you know, you can see that when you look at her eyes. She had some really hooding in her eyes before, and now she's got a supratarsal fold, that kind of hollowing look. And her eyebrows have been gently been brought forward and brought upward a little bit, and I think that is also very powerful. Now, of course, you know, she many times wears her hair down, but you can see her eyebrows, I think, have transitioned upward in a very, I think, good and natural way. And I think that's a very powerful look. And I think the other thing is, you know, she's had some malar augmentation in this area and some jawline refinement. And I think that's, again, all very powerfully done and also very subtly done. And I think that's very, very good, because overdone plastic surgery does not look good. And she's had, I think, a very elegant look, and because she's had elegant, subtle enhancements, which I think really speak well for her choice of surgeon and selection of what she should and shouldn't do. And of course, skincare and makeup are also cardinal to all that, and she leads a very healthy lifestyle as well. And of course, the rumor started in 2013 about her having a breast augmentation, and I think that you know, is certainly something that I think one could make a case for from 2011 to 2012. There's certainly been some changes in this area, and I think that that's also fairly subtle, not overly done, and I think that's reasonable to do. and liposuction. Now, this is from the 2017, 2018, whether she's had liposuction done. I think, again, depends on how you look at it and her shape and contour. And as, obviously as we age, we get fat distribution in different areas in the mid-trunk area and in the buttock and thigh area. So I think that whether she's had body contouring or non-invasive technology, I think still needs to be explored. But I think the enhancement, the breast enhancement, I think is something that she certainly, I think, has had done, and it's been a subtle enhancement, not an overly done enhancement, which I think is good. Then the next thing that we always will look at is enhancement of the midface and implants or cheek fillers. I really think that she's had fillers, and I don't think that cheek implants are not a good thing and not a good look. So I don't think she's had implants. I think she's had fillers placed in her malar areas and her jawline. You can see that, and it really gives her a nice definition and shape. And it's been done in parallel with her lip enhancement as well. And I think that really helps and is a very powerful, useful, and beautiful look. So again, not overdone, but elegantly done. So, and the same with the lips. I think the lips, you can see she's had some subtle enhancement of the commissures as well as her upper and lower lip, but not overly done, because her lower lip is still fuller than her upper lip. And I think that's a cardinal rule for not having it done. But this also emphasizes, when you look at this photo, you can see her nose is narrower, more refined and tipped, and that really helps to define her central face. She now has a supratarsal fold. Looking at her eyes, she has a very nicely defined fold because she's had redundant skin removed there. Her eyebrows elevated, her nose is refined, her tip is refined, and also her lips. So that gives you a very good characteristic look, but it's a look that matches her. It matches her facial structure, her facial features, and I think it's very prudently done. So, and of course, Taylor's stance is that she's denied having plastic surgery, and really that's truly up to her. I think that's totally fine. And of course, this also, many of these things can be natural attributes from aging, makeup, styling, because she's a beautiful woman. Of course, she's going to be critiqued at all angles, at all sides, at all times, and I think that just goes along with it. So I think in summary, Taylor Swift has aged beautifully, and it's a natural, it's a mixture of both these natural factors, normal aging, and then potential cosmetic enhancements, which I've delineated, specifically the nose, the malar areas, and the eyelids, I think, really have gone a long way to enhance her natural beauty. And it emphasizes her comfort and self-acceptance in her own skin. So kudos to her. So I would say that she's had excellent aesthetic changes. She is very, I think, very powerful in how she looks, but also in that she's done a really incredible job of taking care of herself. And these enhancements have only done things to make sure that she maintains her beauty and style. So give me your comments, give me your thoughts about Taylor Swift's subtly changing appearance and helping you become a more educated view. So until next time, enjoy.